evening, good morning, good afternoon, good evening, wherever you are from the world. Lots of familiar names here I can see in the list of participants, both from Srinivasa and from Highline, some people, and our customers and the farmers. Thank you very much for joining. So my name is Venkat Rao, and I welcome everyone to this webinar. And Srinivasa and Highline have had a long history of, best practice sharing, and given, the COVID era, we have now moved to webinars, and now we are going to, start hybrid webinars and also online sessions. I just wanted to, do a quick recap of the previous webinars we done, and I think it's pretty relevant, even what Vitor did last year in May, which is, overcome the high impact of high soya price in feed formulation. And, that's available with us. That was done last year. It's pretty relevant now. Then in February, we did two sessions, one led by Dr. Vitor and the other by Dr. Greg. That was on, the how do you get 100 weeks, the bird to perform for 100 weeks. How do you get the optimum management? What is the management and nutrition required so that you can have the Srinivasa Highline bird lay eggs till 100 weeks? I mean, from the time it starts laying. And then last month we did effective summer management. So these are the three webinars I think very relevant to current times. And if you are a customer of ours, and if you're interested in getting these links, and if you don't have them, I would request you to reach out to your Srinivasa representative, and he would be able to give you these links. Having said that, today's topic is on gout. How do we the causes and treatment for gout, and I introduced to you Dr. Greg, who actually for most of you have been here in the last two webinars, and I see from the list here that there are many thanks. There are many people who are coming in for the third time since I've been part of this. So Dr. Greg needs no introductions to most of you, but there are a few of you I see who have come here for the first time. So Dr. Greg is based out of South Africa, and he would soon be coming to India to visit some of the areas and meet a few of you to understand the challenges here. He is a senior technical person, part of the Highline team, and Dr. Greg would be also supported by Vitor, but today's session would be mostly by Dr. Greg. So without further ado, thank you, Dr. Greg and Vitor, and over to you. Thank you.
Great. Thanks, Venkat. Appreciate that introduction. Yep. Let me see if I can get my screen shared here.
Yeah.
Okay, can you all see the opening slide? Great.
Yes, we can.
Great stuff, great stuff. Okay. In our discussions over the last couple of webinars, and each time that we make a customer call with customers in India, this topic keeps on coming up. You're seeing gout in the field, and there is a little bit of misunderstanding as to why we are seeing it. Now, today's presentation we've entitled All About Gout, Causes and Prevention, and I really do hope that by the end of this you will have a better understanding of exactly what happens to cause the damage to the kidneys that predisposes the birds to developing gout. There are certainly things that we can do from a management point of view, boxes that we can tick to make sure that we do not predispose the birds to these conditions. And we also know that when we do see it in flocks, that there are certain tricks that we have learned that help the flocks to recover in certain instances. So let's hope that by the end of the presentation, we'll have a better understanding of the condition in general, and we'll be able to tackle this in the field. So gout as a condition has been recognized in poultry for more than 30 years now. And due to its striking lesions that we see, many names have been used to describe it, like visceral gout, acute toxic nephritis, renal gout, kidney stones, nutritional gout, nephrosis. There's many. Visceral gout is characterized by this white chalky-like deposit of uric acid crystals that cover the surfaces of your visceral internal organs, such as the liver that you see here on the left and the heart that you see on the right. In the picture on the right, you will also see that there are urate deposits in an enlarged left kidney and on the inside of the ureter. Articular gout describes the accumulation of those urates within the synovial capsule and the tendon sheath of the joints, including the toes and the feet. But where does this uric acid come from? This is the key part. Uric acid is a product of the metabolic breakdown of your purine nucleotides. It is water soluble. It is rather poorly water soluble. But if you've got a fully functional kidney, those kidneys are able to remove it from the blood and excrete it into the urine. It is often visible as that white cap on the feces that you will see as depicted in the picture here in the bottom of the screen. Now, gout occurs when kidney function has decreased to a point where the uric acid begins to accumulate in the blood and the body fluids. The uric acid subsequently precipitates as either calcium or sodium urate crystals in a variety of locations. In visceral gout, this can occur quite quickly, quite acutely, while in articular gout, the picture that you saw in the feet and in the toes, this takes more of a prolonged case of exposure before that actually appears. So this is more of a long-term increase in your serum levels of uric acid before you see the chronic form of gout taking hold. With cases of gout, post-mortem inspection shows damaged kidneys characterized by atrophied or missing portions of the kidney lobes, the kidney, either kidney or ureter stones. It's the white deposit that you see there on the picture. And the remaining kidney tissue is swollen with white urates. Often you will see there's compensatory enlargement of that remaining kidney to maintain adequate renal function. Now, birds that are affected by renal damage can continue to be productive until less than 1/3 of the normal kidney mass remains functional. Now, this is actually quite incredible. While a damaged kidney typically can't repair itself, the condition can be treated if you catch it early on. Birds can recover from acute kidney failure. Damage from chronic kidney failure, however, is irreversible, and there's not much that we can do about that. So the kidney is truly a vital organ. Now, I say this because a bird with no renal function will quite literally die within 36 hours. The primary function of the kidney is to maintain the chemical composition of body fluids. And when I say body fluids, it's really the blood within the bird. It serves a variety of other functions in the body as well. Among them would be the removal of metabolic waste and toxic products, conserving fluids and vital electrolytes, and also the regulation of blood volume. There's one more, I forgot, the production of hormones that regulate the blood pressure as well as the production of red blood cells also takes place in the kidney. The cause of gout is often difficult to determine because the original kidney damage may have occurred quite some time or quite long before the onset of the gout mortality that we see on the farm. But by understanding what can contribute towards the kidney damage, we can better narrow down the probable cause or causes that resulted in the gout that we are seeing. We will look at the following factors that can cause or contribute towards gout. We'll have a look at some of the nutritional factors. We'll look at infectious diseases, toxic agents, and some other causes as well. One of the most common nutritional or metabolic factors known to damage the kidneys is excessive dietary calcium fed to immature pullets. This could result from a simple mistake made either at the feed mill during the milling process, the accidental delivery of the wrong feed. So they accidentally deliver layer feed to a rearing house, for example, or excessively early use of a pre-lay ration in a laying flock. Sorry, in a flock that is not yet in lay. Rearing diets that contain limestone particles in a particle form, so limestone in large particle form size, may allow individuals to selectively pick out those particles, which obviously would then result in excessive calcium intake of those birds that are selectively eating. This excess calcium is eliminated by the kidneys. Now, this is not really the problem. The problem is the presence of high levels of calcium in the kidneys and the urine, as this poses a risk for urate crystal formation. To better understand the role of calcium, or the role that calcium plays, we need to examine the following flow chart. Now, bear with me, it's a little bit busy, but hopefully you will understand at the end of this. Diets containing high calcium, I'm talking levels in excess of 3.5% calcium, and low phosphorus, this would be less than 0.3% phosphorus, support optimal eggshell mineralization while maintaining bone mineral loss and while minimizing bone mineral loss and preventing osteoporosis. So this is typically what we would like to see. However, the low phosphorus in the diet reduces the blood phosphorus levels, which in turn directly stimulates the enzyme synthesis of calcitriol. Now, this active form of vitamin D stimulates intestinal phosphorus reabsorption for the purpose of restoring the normal blood phosphorus concentration. But calcitriol also unavoidably stimulates enhanced intestinal calcium absorption. The flood of excess calcium into the blood directly supports eggshell mineralization and prevents osteoporosis, which is good. But the elevated calcium levels also suppress the secretion of parathyroid hormone, thereby inhibiting renal tubular calcium reabsorption and allowing high levels of calcium to be excreted. This high calcium in the urine is a risk for the formation of the urate crystals, particularly when the urine is in an alkaline or at an alkaline pH. When poultry receive too much vitamin D3, it can result in excess calcium in the blood. A clinical sign of too much vitamin D3 in the diet of laying hens is the production of eggs with calcium pimples on the eggshell. Now, if you have to take your finger and scrape off those little pimples, you will see tiny holes in the eggshell that remain behind. And this is a classical example of too much calcium in the bloodstream. Phosphorus has been shown to partially protect the kidney against calcium-induced damage. And this is primarily because the phosphorus acts as a urinary acidifier and thus helps to prevent stones from forming in the kidney. This is why rearing diets that are only marginally low in available phosphorus have been associated with higher incidence of gout. Sodium bicarbonate is sometimes used to improve eggshell quality or to combat the effects of heat stress. We actually mentioned this in a presentation given previously. Sodium bicarbonate can contribute to gout by making the urine more alkaline, which, in the presence of high levels of calcium, is an ideal medium for the formation of these kidney stones. Now, vitamin A is an essential vitamin for poultry. And if the birds are receiving a vitamin A deficient diet for any length of time, it can damage the lining of the ureters. Now, the ureters, these are the ducts by which the urine passes from the kidney to the cloaca. It's important to remember that vitamin A in feed degrades over time, especially when it's exposed to sunlight. And I know that a lot of our houses are open-sided houses. Another risk is feeding excessive levels of protein. The additional protein in the diet, once it's consumed, is converted into uric acid. And this puts them at risk to possibly developing gout. Infectious bronchitis. This is one that comes up often. It's a highly contagious infection of poultry that normally involves the respiratory tract, but it can also involve the reproductive tract and the urinary system. Certain strains of bronchitis, termed nephropathogenic, have special predilection for the kidneys. One mechanism by which the bronchitis may affect the kidney is by chronic viral persistence and replication, leading to a nephritis, which eventually develops to renal failure over time. As the young birds are more susceptible to bronchitis and kidney damage, the initial infection may occur long before we actually the kidney failure occurs, and we see the chronic mortality in the laying flocks. Can you now begin to understand how this occurs? When pullets, which are sexually mature, are placed on a higher calcium diet to meet the demands of the egg production, if those birds have previously encountered kidney damage, the kidney is simply no longer able to secrete those high levels of calcium that are now in the layer diet or the pre-layer diet. And this calcium tends to build up and predispose the bird to developing gout. Avian nephritis virus. This is not a very well-known virus at all. I had to go and look it up a little bit myself, to be honest. It's an enterovirus that affects kidneys. It has been associated with kidney disease, and some serious outbreaks have been reported in Europe and Asia. When certain research papers have done serological surveys to see what the incidence of these avian nephritis virus antibodies are, they seem to be detected in poultry around the world, throughout the world. But most of the information at this stage seems to suggest that the virus only plays a subclinical role in terms of developing gout or certainly causing kidney damage. But concomitant infections, this is joint infections with bronchitis virus, have been reported from the field. Poisonous substances or toxins. While widely distributed in nature, these are not considered to be a major cause of production losses or disease in poultry. We should remember that some potentially toxic substances are used on a routine basis, and these include things like antibiotics, antimicrobials, minerals, vitamins, manufactured chemicals and pesticides, disinfectants, things like that. And where there is routine use of these products, there is room for human error. Now, I have to admit it, if you have a look at the picture on the right-hand side here, this was a mistake that I made on a farm. We were looking to clean out the drinker lines of those birds while the birds were in the house, so in production. And we made a calculation error between myself and the farm manager, and the next morning we had birds dying, unfortunately, acutely. And when we opened up the birds and had a look at them, there were these typical signs of gout as a result of an overdose of the disinfectant that we had treated the drinking lines with. So although routine use of these products should usually be safe, we can cause problems for ourselves sometimes. If I was to narrow down the list of antibiotics that I would say most commonly are associated with cases of gout in the field, it really would be these two, and that's sulfurs and aminoglycosides. These antibiotics are eliminated from the body via the kidneys, and therefore are potentially nephrotoxic. Some of the sulfur antibiotics that we use also tend to make the water bitter, which limits the water intake of the bird and further poses a risk of developing gout, as there's no flushing effect of the antibiotic from the kidneys. Minerals and vitamins such as calcium, phosphorus, sodium, vitamin D3. These are all minerals that we encounter, or vitamins that we encounter every day, but are potentially toxic to poultry at high concentrations. Disinfectants and insecticides, when used according to the manufacturer's recommendations, are usually safe and effective, but a miscalculation, like personal example of the actual dose can result in toxicity in the flock. Feeds contaminated by mycotoxins and phytotoxins, these are plant toxins, phytotoxins, may also result in toxicity. Citrinin, ochratoxin, ursporin, these are mycotoxins that we know are nephrotoxic. Although these toxins cause alterations in kidney function, they tend to be inflammatory to the kidney tissues, they are not necessarily, they do not necessarily lead to cases of clinical gout. But what you will see is that when we do see gout, it is usually not just one factor that's affecting the birds, but multiple factors. Water deprivation, sure, water deprivation might affect kidney function, but research, believe it or not, has not demonstrated a direct result in gout from water deprivation. The obvious risk without the flushing effect of water, without having that water available to the birds, means that the urates build up in the kidney tissues and predispose the birds to gout. So gout, when recognized as a problem in field cases, is likely to be a multifactorial problem, and identifying a specific cause is often difficult. Another reason for diagnostic difficulty is that the kidney damage occurring during the growing period often has no apparent clinical signs. You would not be able to tell from looking at the chick whether there was kidney damage or not. And until those birds later come into egg production and are fed high levels of calcium, then only do we see the clinical cases of gout and gout-related mortalities. Field cases and research have demonstrated the importance of interactions between usually two or more contributing factors. And I want to make a particular mention here of nutritional factors and infectious bronchitis, those two playing a role together. Some preventative areas concerning nutrition are to feed pullets no more than 1% calcium in a powdered form up to 16 weeks of age. Now, remember, 1% of calcium, these birds are not in production yet. They do not have the calcium requirements that birds in lay do. So we really do not need to exceed that 1% level in the diet. The next one, the powdered form is important because if we include large particle size calcium in growing diets, the birds tend to select it out. And by selecting it out, what happens? They increase their calcium intake, right? Available phosphorus levels should be between 0.45 to 0.5% in your rearing diets. And your pre-lay ration should not be used before 16 weeks of age, or let's perhaps say certainly not when the flock shows, not until the flock shows signs of sexual maturity. Sexual maturity, we know we see blooming of the combs, so the combs get nice, big, become red because of the increased blood flow. So the pre-lay diet should really not be introduced for this period. Why? Because the pre-lay diet contains extra calcium for those first eggs. It is good practice to review all your calcium and your phosphorus levels in the feeding program. I want to say both for your pullet and your layer feeds. These feeds should be routinely analyzed for calcium and phosphorus levels, and we should be adjusting accordingly. If sodium bicarbonate is used in the layer diet, use it at the minimum recommended level and only when needed. A flock that is showing signs of gout or that we know was affected by gout should not be medicated with sodium bicarbonate. The same goes for flocks, for these flocks, is that we should not feed them a ration that is highly alkaline. An example of a ration that would be highly alkaline would be feed that is high in levels of either sodium or potassium. Feed samples could be assessed for the presence of mycotoxins. Yes, sure, that is very good practice. We know mycotoxins can also contribute towards the damaging effect of the kidney. And if we do find high levels of these mycotoxins, we should be adding an effective mycotoxin deactivator or binder to the feed. Avoid on-farm that you're getting your on-farm, sorry, let me start that again. Avoid your feed bins becoming contaminated by either stale, wet, or moldy feed on the farm. We also want to make sure that we are always purchasing from a quality finished feed product from a reliable feed mill where we know the procedures are in place to make sure that the raw materials purchased are quality raw materials and free of mycotoxins. So what do we do for infectious bronchitis? Well, we vaccinate. That really seems to be the way to go, and it has worked. Infectious bronchitis vaccines should be administered according to the manufacturer's directions and recommendations. Okay, that goes without saying. To provide optimum protection, the vaccination program should include several live vaccines of bronchitis, and you can usually mix these in combination with a Newcastle vaccination as an example. And I know that many of the manufacturers provide the vials with the two already mixed in one. We want to be vaccinating the birds about 3 weeks and then of age, and then maybe again at 8 weeks and again at 14 weeks of age, either by a spray or the drinking water. Now, application is really key here. Spray is by far the preferred method as you introduce the vaccine to the mucous membranes that the field virus would attach to. And by doing that, you are not only stimulating the circulating immune system antibodies, but you are also stimulating the local immunity via the generation of immunoglobulin A's. Handling the vaccine has received a lot more attention of late. We now know that infectious bronchitis virus in the vaccine form is very temperature sensitive. And when mixing and applying the vaccine, we should be keeping the vaccine around 10 degrees centigrade. When I first learned of this, it was a big surprise to me because I was always vaccinating with water that was at room temperature. And when you go back and you look at what indeed is room temperature water, it's often somewhere in between 20 and 30 degrees. The colder the vaccine is, once we've mixed it into the water, the more viable vaccine virus is available to immunize the bird. Killed vaccines, these are also a great addition to our vaccination programs, as these vaccines help to maintain antibody protection in long-lived birds. And it is good practice to include them either once or twice in your vaccination schedules for birds that are going to lay past 60 weeks. So that's pretty much all our birds, right? The vaccine strains used should be those that are known to be endemic to your area. Now, routine serological testing can certainly provide us with initial indications of the level of bronchitis virus challenge in our area. But to actually know which virus it is, we really need to be looking and doing virus isolation to best understand the challenge strains that are circulating within that area. You can use SPF sentinel birds. They can be placed in the house, and after 5 to 10 days of exposure, we can make isolation attempts to try and get the virus out again. Now, SPF birds do not have to be all pathogen-free birds. These just need to be birds that we know are definitely negative, have not been exposed to infectious bronchitis virus, so either through the field or not vaccinated at all. The use of several different serotypes of bronchitis vaccine in a vaccination schedule will generally improve the cross protection against other field variants of IB. So this is something that we commonly see done in the field. As an example in the table on the right, where the one vaccination might be with a certain product, and then followed up by the following vaccine would then be a variant that is of a different family group, a different serotype group. Usually you can get away with using 2 different variants in your vaccination program. I have seen programs that use up to 4, 5 different variants. I really do not think it's necessary. I think if we focus that attention rather on the application of our vaccines, we will have far better results in the field. So when gout mortality is recognized, the underlying kidney damage cannot be corrected, right? But treatment may help some birds with marginal kidney function. Current techniques for reducing gout mortality in pullets and layers rely on acidifying the urine to keep the kidney stones dissolved and preserve renal function in the affected birds. Now, we know it is common use that ammonia chloride and ammonium sulfate can successfully acidify the urine. And this little table on the right here gives you the recommended levels to do that. Wet droppings may be a side effect of ammonium chloride usage, but you're not going to see it with ammonium sulfate. After 4 to 6 weeks of the maximum treatment level in a feed, you might have achieved the desired effect, the desired result, and start to gradually reduce the level of inclusion that you have used. However, you're never going to get to a level where you have to pull it out totally. So there will always be some level of treatment, and that's usually around about 0.5% will be needed through the remainder of that flock's life. Both D-L-methionine and Alimet can be used at up to 6 kilograms a ton in the diet to acidify the urine. These are other options. So in summary, I want to say that the presence of gout mortality in pullets or layers indicates some form of kidney damage. Now, the likelihood that we will know what that actual kidney the cause of that kidney damage was is unlikely, but it was most likely multifactorial. If gout is detected, mortality can be reduced by increasing the acidity of the urine to dissolve the existing kidney stones and to prevent additional kidney stones from forming and further damaging the kidney. So that was the last slide. I hope that it has been informative. I hope that you understand that when we do see gout in the field, it is most likely a multifactorial problem that resulted from kidney damage and the building up of urates and calcium in the kidneys, which provided the perfect circumstances for those little urate crystals to precipitate out to form. If we know and understand the way that the disease takes form in the birds, we can obviously make management interventions to prevent it. And I hope that some of this will be useful to you in the field. So thanks for the time.
Thank you, Dr. Greg. That is quite good, informative one, and I hope this was useful for our participants. And I can see a few questions. So one thing is, for those of you who come for the first time, if you have some questions, then we will not be having an opportunity to interact with Dr. Greg via voice. What you will have to do is, you will have to, if you see at the bottom of your screen, there is an option called Q&A. So you click on that and you type in your question, and then Dr. Greg would answer those questions one by one. I can see 3 questions as of now.
Sure. Should I get going? Should I get started with them?
Yeah, just let's wait for a few minutes for people to find where the Q&A is. Sarah, keep that on, please. That slide where you... Sarah, can you hear me? Yeah, yeah.
Vitor, are you available? Should I refer a question to you?
Yes, Greg, I'm here.
Okay, great.
Okay, let's start. And for some
All right.
reason, I can't see the Q&A panel. So, yeah.
Okay, so the first question comes from Govinda Reddy. How can we differentiate infectious gout and management gout under field conditions? So maybe we need to clarify something there. There is no such thing as infectious gout. Gout is not contagious. If one bird has gout, it cannot give that gout to another bird through any form of contact. What we do know is that certain infectious diseases, like infectious bronchitis, are known to cause renal damage. That renal damage predisposes the bird to developing gout because the kidney is not able to flush to get rid of the uric acid and the calcium levels that it should. Once those uric acids and calcium levels build up in the kidney because the kidney cannot flush them out, that creates the perfect condition for the formation of gout. So if we see gout, in birds that we open, we will not be able to tell if this was gout as a result of infectious bronchitis unless we are able to re-isolate the infectious bronchitis virus from the kidney or the trachea in the bird. The cecal tonsils is actually a very good sample to take as well. You might be able to isolate it from there. Management gout, if we've made a bugger up in management, unfortunately, it's going to look exactly the same as your infectious bronchitis gout, certainly under post-mortem conditions. The one other thing that I could just add on this topic is we do know that infectious bronchitis when infectious bronchitis results in gout, it's usually more of a chronic condition. So it takes weeks to show. And we do know that management errors that are made that result in gout are usually more acute. So we see them in a shorter frame period of time. Okay, I'm going to move on to the next question. Is potassium chloride with acidifier in the water effective in controlling lingering mortality? Well, I would certainly think so. If you can acidify the water, we know that helps for water intake in the birds. Look, the gizzard is very acidic on its own, and we have noted that acidifying the water does not tend to have a lingering effect on the pH difference in the gut. So that is possibly where adding the potassium chloride would be of more benefit to you. So my answer in short would be yes, this would be good practice in trying to control lingering mortality as a result of gout. The next question, do we need to reduce the level of salt also to reduce sodium to control gout? Now, before I put my foot in my mouth, because this is more of a nutritional question, I'd like to get Vitor involved. I would like to say no, but let's see what Vitor has to say.
Yes, Greg, I also, we know for sure that salt intoxication or sodium intoxication can be one of the causes of kidney stress. So I understand where the question comes from. But we also understand the sodium has some very important roles in egg production, in shell quality, in the muscle contractions, so, and especially on the behavior of the bird. So I would try other practices before going to reducing salt, because this can be, we can have some other issues instead of fix the gout problem. So yeah, I understand where the questions come from, but I would try other practices first.
Great. Okay. So the next question is from Karthik, and it's related to vaccination for infectious bronchitis. In addition to your infectious bronchitis, to your IBV suggested vaccination schedule, can we use MA5 and 491 at the first day? And this is in line with the protector type concept, I think, that is marketed by MSD. So the answer here is yes. You can certainly use both MA5 and 491, a full dose of each, and apply it at the first day, either in the hatchery or on the farm. This is an interesting one because mixing those two variants together and applying them at day old or first day of age seems to have a benefit to the bird. They both take. Doing it later on in the program doesn't work. So I do not advise mixing two infectious bronchitis virus vaccines after the first day or the hatchery application. The protector type that MSD markets is specific to day of age. Thereafter, it's individual antigen application, but alternated, as you saw in that diagram. So the 1 week would be MA5, followed on by a 491, and then again an MA5 and a 491. And by alternating those two serotypes, you get the cross protection to other field variants that we find on the farms. So yes, it would certainly work. The next question, what is the role of electrolytes in gout? So I had a colleague of mine who said something interesting to me one day. He said, anything is toxic in the right amounts. He said, water can kill. He reminded me that water could kill you if you drank enough of it. And he's 100% correct. So we do know that electrolytes are essential for the production and the performance of our birds. However, we can reach excessive levels, and these excessive levels can cause damage to the kidneys. Any inflammation, any damage to the kidneys will then hamper their function and result in predisposing those birds to developing gout. So perhaps not directly, but certainly indirectly, yes. Vitor, have you got another comment there?
Yeah, Greg. No, I'm fully in agreement with you. The three main minerals with charge or electrolytes that we have for poultry, sodium, chloride, and potassium. For sure, they will have a role in the uric acid excretion, the renal function, but I agree with you, they are fundamental and they have a lot of other roles. So I would say they would have, I agree with you, an indirect role. And especially, I don't see so much a direct role. It's very clear when you have like excess of physical activity, that can be an issue to overloading the kidney if you have a slightly unbalanced electrolyte balance. So maybe, I don't know if for free range could be an issue, but in cages, I don't know. I really can't think in a direct effect. Maybe we need to research this more, but yeah, I agree with you. More an indirect effect, maybe.
Okay. All right. Good. Arvind, you've asked me a question here. What are the phytotoxins? I think you're wanting me to give you some examples of phytotoxins, right? And I'm going to have to get back to you. I know that these phytotoxins, these are actual plant toxins. There's a list of them. I, to be honest, didn't memorize them before our presentation, so I can certainly pass that on to some of our technical people. If you would let your technical person at Srinivasa know that, put up your hand that you asked this question, we can certainly follow it up for you via email. The next question is from Saif. Any effect of dietary xanthophylls, aposters, on gout development, specifically in the prelay phase? Vito, I'm going to have to hand that one to you.
Yeah, I would hand it back because I don't know. It has a very interesting effect in hatchability, in internal egg quality. In gout, I really
No, I can't.
well, yeah.
I can't see any
Let's.
benefit to it, to be honest, because I do not see any direct relationship of it's either supporting or negatively affecting the kidney.
Yeah, me neither,
Okay.
Greg.
All right, let's move to the next one. Forced remalting, is that an option for severe gout cases? No. So when we molt birds, what do? We put the bird into a stress situation. That stress situation effectively takes them out of lay. They do not have the nutrients in the diet to support both their requirements for metabolism as well as their requirements for egg production. So the birds go out of lay. Effectively, what we're doing with a molt is we're rebooting the system. If you've got cases of gout, that damage is already present in the kidney. And by further putting stress on the bird, by denying her water, by denying her feed, we are going to put that kidney under additional stress. And I'm afraid we're only going to worsen the situation. So certainly not improve it. So a forced molt is not recommended with cases of gout. Next question, in endemic areas of gout problems or farms that experience gout problems, we are following day 1 IB spray beak dipping before placing the chicks into the brooder. But your recommendation of first vaccine is at the 3rd week of age. How can we expect local immunity before 3-week period? Please explain. Okay, so this practice that you are currently doing by doing day 1 vaccination or at the hatchery vaccination is correct. Please don't misunderstand me. The first vaccine for IB I like to do as early as possible, so preferably in the hatchery. We then follow that one on either 2 or 3 weeks later on the farm. I would prefer 2 weeks, so rather sooner than later. We simply cannot expect any local immunity. You're 100% correct before that vaccine is there. So that is why we want that vaccine to be applied either at day 0 or day 1 as to be the first exposure and provide local immunity. Next question. Is there any genetic relationship with nephrogenic IBV virus? Genetic relationship? I'm struggling to work out what you mean here. So what we know with IB viruses, well, we all know COVID-19, correct? And infectious bronchitis is essentially the same group of viruses, COVID-19. And what have we heard of late? There've been Delta variants and Omicron variants, and as the virus is moving within our human population, it encounters situations that predispose, that allow that virus to mutate and change. And it's exactly the same with infectious bronchitis virus in the field. The virus meets certain conditions that allow it to mutate. Those mutations work for the virus, and the virus is able to replicate. And with each mutation, the virus changes slightly. And this is why we get strains that are nephrogenic, and strains that are strictly respiratory, and strains that cause things like the false layers, as an example. The QX strain from China is one of the very well-known ones. And usually these groups, as the mutations occur, these groups put them into certain family groups, and those family groups are specific for relatively specific for the type of clinical signs that they produce in the birds. So your QX group of viruses will show those false layers. Your nephropathogenic group of IB viruses will tend to give you the damaged kidney signs and signs of gout down the line. So there is certainly a genetic relationship to those family groups that cause the clinical signs that we see in the field. I hope I've understood the question correctly. Dr. Schinde, you've asked a question regarding the recovery strategy. If the gout is caused at onset of, for the gout caused at onset of egg production due to metabolic disorders during the growing period, the treatment and the time duration required for the complete recovery from the gout. So, caused by the onset of egg production. So if we've had problems, metabolic problems during the growing period, which are manifesting in cases of clinical gout in egg production, this tells us that there is a fair amount of kidney damage, right? We know that the kidney the bird can continue to survive with as little as a third of functional kidney tissue remaining in the bird. But when we see clinical cases of gout, that means that there is definite damage to that kidney function. So the degree of damage is difficult to determine. It's almost impossible to gauge just by looking at the flock or looking at the flock's performances or even mortality pattern. The treatment and time and duration required to complete recovery, I would almost hazard a guess that there will never be complete recovery. We can certainly improve the situation and perhaps reduce the level of mortalities that we are seeing, but we will never have that flock free of the kidney damage that has resulted. The time duration, when we take measures like acidifying the urine, we usually do it at a good concentration for 4 to 6 weeks, or until we start to see a reduction in the mortalities. Once we've seen that, then we can step it down to a lesser inclusion of the products that we are using to acidify. Okay, Mahesh, how much parts per billion or parts per million level of mycotoxin can cause renal damage or gout or liver damage? So what we know is the mycotoxins have not been linked directly to gout, but we know that mycotoxins cause kidney inflammation. And that inflammation, if it's excessive, can cause kidney damage, the necrosis of those actual kidney cells, and that would hamper the function of the kidney. So to give you an indication of what the exact level of mycotoxin would be that would cause this would be difficult to say. And what I would defer the question rather and say, if we are detecting mycotoxin levels in our feed that is flagging what do we call it, Vitor? The minimum concentration, the maximum concentration, the allowable concentration, right? If we are detecting levels that are outside of that range, we should certainly be doing something to counter this.
What I would add, Greg, is that the approach to mycotoxins is changing a lot. And a lot of companies, they don't even give us anymore maximum level or a safe level for mycotoxins, because it changes a lot from, first of all, if you have an interaction with other mycotoxins. So mycotoxins is a typical case that 1 + 1 is 3 or 2.5, because especially in case if you're talking gout, if you have ochratoxins that directly affects the liver, the kidney, sorry, with any other toxins. To give you some numbers, usually we say 10 ppbs of AFLA is safe, up to 40 ppbs of ochra is safe. But if you have the both of them together, they say maybe 70% of each is enough to cause damage. And
Yeah.
also you have to put together the metabolical phase. If you have a pre-peak phase, birds that are going into production, they are putting body weight, for sure half of these levels can be a problem. If you pick up a phase where the metabolical effort's not the same, the birds can cope with a little bit more. So it's becoming a little bit more dynamic and not so a static recommendation of maximum or safe levels.
Good points. Good points. I see the next question is directed to
Okay,
you.
please explain any relationship. Oh,
Oh,
we
where'd
lost
it
the
go?
question. I guess
So
let's
if I
see
remember it
probably
correctly,
if it's in
answered.
answered. Where is it?
The question is, please explain a relationship between total phosphorus percentage level and available phosphorus percentage in rearing period and causes of gout in later part of the age. That's from
Okay.
Dr. Prasad.
So the total phosphorus and available phosphorus, it changes a little bit, of course, depending on what is the source of phosphorus that you are using. If you are using animal sources, meat and bone meal, if you are using a phosphate source, and especially if it's a mono calcium, a D calcium, a 3-calcium phosphate, if it's a monosodium phosphate, all of these, they're gonna have a different levels of digestibility. So you change a little bit the relationship to calcium and total phosphorus and available phosphorus, and even digestible phosphorus, that's what we have in our tables now. So this can easily change from low 70%, 72% to almost 90%, depending on the source that we have. And of course, that's the dangerous, that if you are doing a formula with total phosphorus and you change the source of the phosphorus, you can suddenly have a severe decrease of available phosphorus with the same amount of total phosphorus. So that's why in our guides, we don't even have the reference of total phosphorus anymore, because I can't see one single reason why to make a formula with total phosphorus instead of available phosphorus, because we have a lot of good matrix and information, and you are eliminating one of these risks, that it's a completely different digestibility, and you suddenly have a lower phosphorus levels. And we know that this is something that clearly going to affect the digestibility of calcium, and suddenly you can have a lot of non-absorbed or digested calcium circulating through the body of this hen or this pullet. And of course, this will damage the kidneys and generate some problems. So yes, I understand the question. It's a very interesting question. And my recommendation for this, don't use total phosphorus. Use available, use digestible, and this you can at least eliminate a little bit the problem, especially from pullets. Adult hens that have coarse limestone, they can have a little bit more selective eating, and the calcium requirement is much higher. It's very difficult to generate hypercalcemia. But in pullets, yeah, you need to be careful with that. The next question here, including the L-methionine up to 6 kilos per ton of feed, is this advisable or any nutrient interaction will take place? Specifically for gout, I can see some interesting facts with the liver. But no, with gout, I really need to research a little bit more. I can see the clear relationship for sure. 6 kilos per ton of the L-methionine, that's gonna boost a lot your levels of methionine and M plus C in your diet. This would easily be like a 60, 70% methionine to lysine ratio, while we are recommending 50%. That for sure would overcome 100% relation between M plus C and lysine. And for sure, we don't want a big egg weight profile for especially in India now, right? So yeah, I don't understand so much what would be the benefit, but for me, we would have a lot of potential side effects here. So I would be a little bit careful with this approach.
Okay. Here's a question. In recent times, in some highline batches, I've noticed lameness issue in laying batches, while there is no damage noticed in the eggshell. The calcium percentage they are giving is around 4.5%. What is the calcium requirement for highline laying batch? So I would imagine that's for highline birds inlay, our W-80 inlay.
Yeah. So calcium in general, we're gonna say, depending on the phase, between 4 and 4.7, 4.8 grams per bird per day. The lower number, of course, on the beginning of the lay, the higher number at the end of the lay. But also it's a little bit dynamic. And in my opinion, whenever you have lameness on laying hens without seeing eggshell problems, you need to investigate phosphorus or anything related to phosphorus metabolism. And usually we're gonna see even up to the point of, severe cage fatigue when you don't have enough phosphorus or you don't have enough nutrients to support phosphorus absorption. But also it's a little bit also correlated to calcium, right? So one thing that we are asking here and saying is about calcium requirements, but you also need to talk about the quality of the source of the calcium.
Yes. Yeah.
So if you are giving 4.4 grams, 4.2 grams of calcium with a limestone that has 38% of calcium, it has less than 0.6% of magnesium, that has a solubility, if it's a coarse limestone, lower than 20%, if it's a fine limestone, higher than 80%, that's something. But now if you have this exactly the same amount of limestone or calcium in the diet, but with a limestone, with a poor solubility, with high magnesium, with low calcium, for sure, the result's gonna be completely different. And then the consequence of that is you're gonna deplete more calcium from the bones because the calcium from the feed is not enough. And when you deplete calcium from the bones, you are depleting phosphorus from the bones. So you are generating two problems. You are increasing the more or the more problematic is your source of calcium, more phosphorus requirements you're gonna have, and more you're gonna predispose your flock to lameness or cage fatigue. So it's a phosphorus issue, but this phosphorus issue can also be a consequence of poor calcium quality or limestone quality or whatever source of calcium is.
All right. Next question is an interesting one. Will diuretics help in gout? In theory, yes, it should, right? Certainly with getting rid of the buildup of uric acid and excessive calcium. In practice, no. If we use products like this, it makes the litter or the manure impossible to handle and deal with, and that causes other problems down the line. So in theory, it's something that could possibly work if we had a very controlled environment that we were able to maintain and possibly try. I have tried it before myself, didn't get the results I was expecting, but it just made the manure totally unmanageable. We had to actually get a truck to come and suck it out. So we couldn't shovel it out. So we'll skip that idea. The next question from Governor already. In spite of 3 live IB vaccinations before 28 days of age in layers, and 1 live vaccine at 12 to 13 weeks of age, and 2 killed vaccinations at the 7th day and 16 to 7 weeks, we are unable to control gout. Can you suggest some effective vaccination program? Well, I would certainly like to discuss this program with you. in fact, I would recommend that you get hold of your Srinivasa technical person, and that the two of us, and so that we can exchange emails and perhaps revise the vaccination program that you are currently on. I'd also very interested to know which vaccines you are using. But if I was you and I was finding that a program like this was still not getting the protection that we are looking for, I would do one of two things. The two questions would be in the back of my mind. Is the gout that we are seeing as a result of IB? So that's the first question. And the second one is that if it is an IB question, IB cause of gout, are we applying and handling our vaccines in the correct way that we are getting sufficient protection? So the program is a part of that, the where we are applying those vaccines, but also how we are applying those vaccines, how we are handling them, how we are treating them in order to get the immune response that we want out of those birds. If the IB is not the underlying cause here, remember there's other causes as well that can cause tissue damage. Those certainly also need to be evaluated if we are sitting with chronic cases of gout on the farm. Next question. When we face problems of pimple eggs, what steps should be taken to reduce it? Well, I mentioned to you in the presentation that pimple eggs are an indication that we've got excessive levels of calcium in the blood, right? So what we need to do, we need to go and find out where's this coming from. Are the birds selectively eating out our calcium grit? Are our calcium inclusions in the ration correct? So that would involve an evaluation of the actual diet. Vito, can you think of something else?
Greg, yeah, pimple eggs for sure. It's invariable consequence of high cal.
Yeah, I mean, the bird would essentially, if it is exposed to, let's say, normal levels of calcium, it will get rid of that calcium. That's usually, we don't need to intervene. What we need to find out is where's that excessive calcium coming from.
Exactly. Yeah, for sure. And one of the things that it's quite common sometimes, it's when you have abrupt change of temperature, especially when you go from summer to winter, you can have an increased intake of calcium because of the increased feed intake, the increased energy requirements by thermoregulation.
Of course, yes, good point.
So yeah, this can happen. And one of the things that also happens in normal levels of calcium, when you have a limitation on the water intake, then this could overload a little bit the kidneys, then it can generate some problems, and you can make a little bit of almost a hypercalcemia, especially if you have, and that would be another one, if you have a unbalanced course to find limestone proportion in the feed that the birds cannot selective eating.
Yeah.
So I would think about these three.
Good points. Okay, so the next question, I hope I understand it correctly. Can any live or killed or combined vaccine response in IB affected gout cases? So I'm going to answer this in two parts, just in case I've got it wrong. So firstly, can any live or killed infectious bronchitis vaccines cause gout? And the answer there is no. Even if you are using vaccines strains that are known to be, or that were originally isolated from the field that caused these renal damage, these vaccine strains have been so attenuated, they've been so changed that they no longer produce clinical symptoms in poultry. And even if you pile different vaccines on top of each other, or if you overdose those vaccines, you simply cannot get it to replicate those clinical symptoms by using vaccine. In case I misunderstood the question, is vaccine beneficial in cases of gout? It's not, because the damage has already occurred, and the gout is the end result of kidney failure. So we would only be able to work for the flocks to come, if we are confident, if we know now that we think we have identified the cause of the gout that we are seeing is definitely related to IB. We can put plans in place to better our vaccination or our application program to prevent it going forward. Next question, when to start and stop the pre-layer diet with respect to avoiding gout and maintain optimal production performance?
All right,
Can I give that one
Dr.
to you?
Biswal, good to have you here. Congratulations for the marriage, by the way. And start and stop relay, for sure. It's on the paper is very easy. It's 10 to 14 days before starting the production. On the field is a little bit more difficult because you don't always know when this is gonna happen. So the idea behind this is the higher calcium amount you give without an egg production, more problem you have of hypercalcemia and gout and all the issues. The more eggs you produce with a low calcium diet, more you're going to deplete reserves and lower going to be your eggshell quality. So you need to find a balance. And for me, one of the critical things to find a balance is you have a uniform flock. If you have a uniform flock, you're going to have a little bit more concentrated time to have the onset of production and the peak of production. In this case, usually you try to concentrate the periods that you are providing the prelay around with the light stimulation. So from in a uniform flock that you are light stimulating on the normal body weight, if you are talking about W-80, almost around 1.2 kilos, a little bit less. You're going to have 10 days, 12 days from the light stimulation to have a uniform onset of production. And that's actually the amount of time that you need to feed the prelay, up to 14 days. So what I would recommend, if you have a uniform flock, if you're going to stimulate at 1.21 to 1.2 kilos, start to regulate the developer or the grower phase diet amount that you have, the supply that you have. When you are getting close of the light stimulation period, and then you light stimulate and you start the prelay at the same time, and then you're gonna see the first eggs at no more than 2%. This flock should be eating high calcium diet. So that would work, especially if you have a good uniform flock.
Great. Is IB killed advised in mid-lay if the flock suffered with gout in the initial phase of lay? No, you can certainly use an IB killed in the middle of lay. There are flocks where that is applicable if they are in really challenged areas, or you've got parent flocks that you want to boost the maternal levels of antibodies that they pass down. But if you are doing it with the hope that you could improve the gout situation, it's simply not going to work because that damage has already occurred. So you've missed the boat, so to speak. The additional vaccination, if we were to do any, would needed to be before the signs, before the actual signs of gout showed, and in fact before the damage, the kidney damage occurred. So we need to go further back and investigate where the initial challenge came from. Should I decrease calcium percentage below 4% in gout-affected flocks already in production? Would you like to take that one, Vitor?
I would say, as always, it depends, Greg, and it depends on the amount of affected birds, and the more, and depends a lot of the general condition of your flock.
But we really don't
sure,
want to go too much below 4%, do we?
Exactly. And I don't like the idea of damaging a majority of good hens because of minority of sick birds sometimes. So I would rather lose this, I don't know how the percentage of birds that you are losing because of gout, instead of completely depleting the calcium reserves of a bird that's going to peak of production. And it was supposed to have an almost 2-year cycle of production ahead of her. And that won't happen if you go the calcium below 4%. So as a general answer, I would say no, I would not recommend that. As a practical answer, let's analyze the percentage of the flock that's been affected, why it has been affected, and what's the general condition of the flock.
Good.
And Greg, I also saw probably the question was removed because we talked about this, but the methionine use
Yes.
for gout, and it can be helpful because methionine it's gonna acidify a little bit the environment. But again, 6 kilos per ton is not much. We have even, I don't know if everyone is aware that we have a technical update on gout, and we have even a little bit of table there showing some ideas on methionine, but no, not that extreme, but can be a little bit helpful because it's acid.
Good. The next question is another vaccine question, and it's, do you prefer an IB killed with a nephropathogenic strain or live vaccine like 491? The next part of the question relates to the answer. If I prefer the killed, can I suggest a suitable schedule for gout? So when it comes to IB, I really do have a preference for the live vaccines. I believe that they offer a greater level of protection because you're giving protection to both the local mucous membranes where the virus initially attaches, the field virus initially attaches, as well as stimulating the humoral immunity, the circulating immunity within the birds. So you're pushing the antibody titers at the mucous membranes as well as the ones that are circulating in the blood. Whereas the killed vaccines really only push the antibodies that are circulating in the blood. It's not to say that they're not useful. It's only if I have to take one or the other. I usually prefer to have a good solid live IBV vaccination program. When I do use the killed IBV options, it's usually in a combination oil with other antigens like Newcastle, EDS, Coryza even. So I tend to combine it in those options and rather juggle my live IB vaccination variant strains to get good protection. Dr. Lama, the next question. Before pullet stage, how many live vaccines and killed vaccines against IBV? So what we typically do is we will do a day, this is now live vaccines, we will do a day 0, day 1. We will then follow that up 2 weeks later, follow that one up 3 weeks later, follow that one up 4 weeks later. So that will give us at least 4 live IBV vaccinations in the pullet program. Sometimes we like to squeeze in a 5th one, either just before we move those pullets, or we can shorten the intervals of the weeks between our vaccines. So 4 to 5 is typically what we see. Killed vaccines, if we look at the recommendations by the manufacturer, they always like us to give 2. I think we can get away with 1 if we are using enough live infectious bronchitis vaccine. All right, next one. Is that advised to use 100% calcite powder instead of grit in gout-affected flocks? I imagine that this would be gout-affected flocks in lay. Vitor?
I would say no.
Yes.
I would say no because coarse limestone, they can select eating. Not all the birds gonna be affected as equally. So it's important for them to be able to select the amount of calcium they are eating. What would not happen with the powder calcium source. So as a practical recommendation, I would probably say no.
And they might see some eggshell problems late down the line if they
for
carried
sure.
on with this practice. Yeah,
For sure.
What is next question? What is the level of calcium advised in mid-lay diet? Is it 2.5% or less in gout-prone areas? Well, this is linked to, I think, one of the other questions that we had, if we could drop it below 4%, right?
Yeah. Mid-lay diets, mid-lay is pre-lay or mid-lay is the middle of the cycle? If it's pre-lay,
middle of the cycle, yeah,
makes sense. 2.5, 2.7.
Oh, yeah.
If we are say the middle of the lay, that's not enough for sure.
Okay. The next is just a request. If we could share the recording of the webinar, that will be done. I think that Venkat, when we finish with the questions, will just give you some more information on that.
Yes, I will.
Great. Allopurinol, do you know the product, Peter?
Allopurinol. No.
Okay, Dr. Lama, I'm going to have to get back to you on that one because I'm not very familiar with the product. So I'll move on to the next question. While treating gout, we start with a higher dose of ammonium chloride or I gather this is ammonium sulfate, to gradually lower the dose, 4 kilograms per ton for 2 weeks, then 2 kilograms per ton for 2 weeks. But in your lecture, in the presentation, you suggested with a low dose of ammonium chloride to gradually increase over weeks. I wonder if you could clarify that. So I would agree initially at starting at higher doses. Let me just go back to my presentation and see if that wasn't one of the in that table.
Greg, just
Oh, it's the table. Yeah,
yeah.
it's
just
in the
Googled
table.
here. Allopurinol is a uric acid reducer. It's a drug used for gout treatments in humans.
Oh,
Allopurinol.
well, I guess I'm lucky that I don't
Yeah.
recognize it.
Yeah,
Haven't had to use
that
it
makes
yet.
2 of us.
I'm going to share my screen quickly just because I think the question. Oh, okay.
Yeah, ammonium chloride, we have a table.
It's that table that we use there. So the first week goes to at 2.5, second week at 5, third week at 7.5. This is kilograms per ton, and by the fourth week, 10. So it goes up as opposed to I think what Gothaman is doing, where he starts high at 4 kilograms for 2 weeks and then goes down 2 weeks to 2 kilograms per ton the week thereafter. Do you? Well, obviously this is in our recommendation, so it must be the collective opinion that doing it this way would be the better way to go around. But do you see any negative effects of doing it the other way around, the reverse, starting high and working low?
I've never seen Greg.
Okay, so I would imagine that starting with a lower concentration and increasing it would allow the bird to adapt to those changing levels. So 4 kilograms per ton, it's not excessive. We're looking at, that's closer to our 2-week treatment recommendation. So I don't think that what you are doing would be incorrect if you are getting the results. However, what we have got in our guide is to do it the reverse, to start off low and then slowly increase it, like you've pointed out. Next is another question on infectious bronchitis, and that's, is there any history of vertical transmission of infectious bronchitis virus, particularly the nephropathogenic strain? No, there's not. So we've never been able to prove this or to show this. The virus usually infects the birds via the respiratory tract. It then moves systemically into the kidney, replicates there, causes damage. But even those strains that are known to be associated with the oviduct and with oviduct replication have not been shown to vertically transmit, which is quite interesting. So infectious bronchitis is not one of those viruses that we are concerned about for vertical transmission. Next question is there any relation between metabolizable energy of the diet and calcium percentage in the layer diet?
It's an indirect correlation because in general, lean hens, especially leghorns, especially the white varieties, they regulate the feed intake according to the energy level of the diet. And the feed intake is going to regulate everything else, the calcium intake, the amino acid intake, the vitamins intake, the phosphorus intake. So if you have a very low energy in the diet and medium to high level of calcium, especially a non-selective form of calcium, then yes, you're going to have increased feed intake and increased calcium intake as a consequence. So there is no relation. I couldn't give you a number because we know that the energy effect on feed intake changes according to the temperature, changes according to the stocking density, changes according to the age of the bird. So there is not a proper number to put here, but you can say that yes, there is an indirect relation between them.
Okay.
Level of calcium. Oh, sorry, Greg,
Yeah.
go.
Sorry, this question is similar to what we had earlier.
Yeah.
It's what is the level of calcium advised in a pre-laid diet? Is it 2.5% or less in gout-prone areas?
Yeah, so what I would say, there is not gout-prone areas, there are gout-prone situations. And for sure, we need to identify why this is happening in terms of everything that Greg already said here, and try to fix that. I don't like the idea to give less calcium than that.
Yes.
Because you are trying to prevent a gout issue. Because for sure you're gonna be in a situation that you don't have enough calcium reserves in the
exactly.
Medullary bone, and then you're gonna have a lot of issues. So yeah, try to fix the gout issue, but do not give low calcium diets, because the side effects would be more expensive than the gout issue.
Yeah. So I just want to reiterate here that high levels of calcium is not what causes gout. That's not what the presentation was about at all. High levels of calcium, the bird will simply excrete. The problem comes when there's kidney damage and the bird can no longer excrete that calcium. So what we need to figure out is go back a few steps and figure out what is causing the actual kidney damage. If we fix that, we simply do not put the bird in the situation where it cannot excrete excess calcium or excess uric acid. So that's really where we need to go, is back and not be changing our calcium levels in the laying diet. Next question. Can diuretics, I think we had this one, like furosemide, be a good option for birds affected with gout? Well, as explained earlier, in theory, yes, it should help. It should certainly help to flush some of the deposits from the kidneys. In practice, though, on a farm, does it work? It doesn't work. It just makes a mess. And I didn't have any benefit personally from when I did try it on one of our cases. So good in theory, not so much in practice. Ooh, I think this might be a little spelling mistake. Will urea adulteration of ingredients cause gout? I think it's alteration.
Yeah, it's an interesting one, Greg, because that's one of the most common contaminations of, not contaminations, it's really alteration or adulteration. Is there, for example, if you have a soybean meal and you try to make things a little bit more, let's say, profitable for the one selling, you can put some sand or anything on the same color in that batch, that's gonna for sure dilute and decrease a lot of the protein. And since the protein analysis that's the issue, a lot of us still are doing only protein analysis of the soybean meal and not sending to a NIR to analyze amino acids as well. Then they put urea on it, because basically they're going to increase the nitrogen level, and you're going to still have the 40-something% of nitrogen in that sand soybean meal mix. So that's why I always recommend to analyze minerals and ash on the soybean, because if you have sand there, you can cut a little bit easier. So I never thought about this with gout, but for sure, if you have a lot of urea in there that can affect the uric acid production, that would be a possibility. And yeah, analyze not only protein in your soybean meal, analyze the minerals, analyze the ash, and especially if you have amino acids, because then you would catch this contamination a little bit easier.
Yeah, good. Well, Venkat,
Okay.
I think we managed to work through that list.
Yeah, and very good. Right on dot of time we're completing. I think pretty interesting conversation. Your presentation was, I think, about 35 minutes. The question and answers was nearly 1 hour. So, right? So I think a lot of interest and appreciate all the questions. I've asked
Good.
few of the internal Srinivasa people to, write directly to both of you because we were
Please.
running out of
Yeah,
time. Yeah. Thank you, Greg and Vitor. And I just also wanted to let everybody know that we are just finalized a new management guide. It should be soon with you. And, it's for, we have actually studied the results of W-80 in India for last 4 years. And, based on that, based on the field studies and the data which is had, made some recommendations. So Dr. S.S. Prasad, Dr. Krishna Reddy Garu, and a few other people, Dr. Sridhar, Suresh, and then worked with Vitor and, you know, revised some energy recommendations. The good news is that the feed cost, and correct me, Vitor, if I'm saying something wrong, that, with this new management guide, the feed cost would probably come down because we are saying a
Yes,
little lower,
correct.
right?
That's
So
correct.
yeah, so look out for that. There is a very good information about DB King and all of that. So what you can reach out to your Srinivasa salesperson or the technical person, and it will be soon sent to all the Srinivasa people and then through them to our customers and all the doctors who we work with. So that's a very good news given that high feed prices and low egg prices, and the feed prices don't look like they're going to come down anytime. So that's the good news I wanted to share. The second thing is you will be receiving a survey link at the once this session is over. My request is to let us know which what is the topics you're interested in. This is what we are thinking would be helpful for you, and for our teams also, and what we hear from the teams. So if you have a request for any particular topic we should cover, then please do let us know that, and we will be sharing the recording of this particular webinar, and the previous webinars also are there. So you can actually go through them. And for the people who joined late, a little late after 6:30 India time, as I said, the one we did in May last year, which Vito presented, is still relevant. How do you keep feed cost low when soya price is so high? I think that's still relevant. You can still go through that recording. Then we did optimal management in February on both optimal management of the flock till 100 weeks in single lay. That was in February. And then in March, we did summer management. So those recordings are available with your Srinivasa representative. And, please do go through this webinars. We, both Srinivasa and Highline, are clear that we want to continue these webinars, and also soon we'll be launching some, small, in-person seminars and, all of that. We're working at Vitor and Greg and team coming to India soon. So that will also be happening. So stay tuned for that. We have hopefully have got COVID behind us, and we can actually meet in person and, take highline benefits of the bird, which is number one bird in the world, to our farmers and our customers. With that, thank you very much once again for attending and all those interesting questions. I think even Greg and Vitor learned a few things today looking at the questions. They had to Google. I saw Vitor Google for something. So that's really good. Thank you very, very much. Unless Vitor or Greg, you have anything else to say. Um,
Thank you.
Our
Thank you, Venkat.
pleasure.
Thank you,
Yeah.
everybody. It's been a pleasure. Yeah.
All right.
Okay. Thank you. Bye-bye. Take care. Be safe, everyone.
Thanks, guys.
Thanks. Bye.
Bye.